We are in the realms of contemporary Pilates and an exercise well known inside and outside the Pilates world. It's called Mermaid. Martina and I will show you a variation of Mermaid. There are many variations. This is one of them. And while Martina is demonstrating the movements, I will be elaborating on our exercise aims, and I will also show you some tactile instructions. So we'll do Mermaid in tailor sit. Usually it's done in a Z sit, but of course a tailor sit is always a good alternative. The pelvis is centered and the spine elongated. So Martina brings her awareness first to her center. Pelvic floor, deep abdominals, transverse abdominis, and multifidi lightly engaged. Just enough to give her lift and dynamic stabilization in the spine and the pelvis. There's also conscious awareness to the breath. The diaphragm is part of the center, and the breath is a key ingredient in the movement. So to assist the length, I can already use tactile instructions, and one is to place my hands on the sides of the rib cage firmly, but without being hard. Placing my hands flat on the sides of the rib cage and then lift. And it's just a really nice sense, even for someone as lifted as Martina, it's just a nice sense to get that extra sense of space in the waistlines. Another tactile instructions I could do, I can lightly place my hands on the side of Martina's head. My thumbs are at the base of the skull, and I just give her a sense of direction upwards, creating extra length in the neck. And that's a really ideal starting position. Martina then takes her arms out to the sides. I can place my hands to the side of the rib cage again and guide the movement. It is lateral flexion to start, and then returning to a centered position. So it's a sense of lift into lateral flexion and then returning to an elongated position. So with my right hand at the moment, Martina, if you stay on this side, with my right hand, I can just lift Martina's right waistline a little bit. So this is a lovely sense once you are in lateral flexion, and also to return to a centered position. I just give the lightest impulse with my hand. It's like, aha, that's the direction. So the other hand on the ribs also has a purpose. I'm now moving again to my right hand. I can give Martina a sense of direction for the breath. So the breath is flowing deeply and it's guided into the side of the rib cage. And with my hand on the side of the rib cage, this is just really lovely tactile feedback. And the hand is very light. It requires hardly any pressure. And then back to a centered alignment. Sometimes what we see is a little bit a drop into the lateral flexion. So Martina, if you can have your intention go down, this is an excellent demonstration. Martina's intention has now been going down. And then if you come back up to the center, she still does it really nicely. So think down again. So if thinking down, there is too much shortening here. There's a sense of collapse in this side of the body. So once again, I can assist that with my tactile cue to give Martina a sense of lift. So although the movement is going over and kind of down, by sense it's going up, upwards and to the side, maintaining length in both waistlines. Beautiful. Then what we also see sometimes is a shift. So ribcage shift as in translation, and then into lateral flexion. So that's also not what we are aiming for. It decreases the length. So same thing with my hands on the ribs. I can assist the alignment of the sides of the body, preventing, if you like, the shift. Now the second component of the exercise is a rotation. So Martina first moves into lateral flexion, And then we're aiming to rotate the thoracic spine. So by sense, the sternum is rotating down, and Martina actively connects her external oblique abdominal muscle on her left side into her internal oblique abdominal muscle on the right side. Then spine rotators are engaged back to a lateral flexed position, quadratus lumborum a little bit, and then emphasis on the oblique abdominal muscles to center her. So lifting, inhale, so it's the lift we talked about before, that's an inhalation. With the exhalation, that thoracic rotation connecting external, internal oblique abdominals. With the inhalation, it's again a lengthening into the side bend, back muscles engaging, emphasis on the oblique abdominals to return to a centered position. Fabulous. So let's look at it kind of step by step. Martina can turn to the side. And let's have a look at the pelvis first. Sometimes the pelvis is exactly as good as it can be, so it's centered. Sometimes it's actually tilted forwards. If someone is really, really mobile, the pelvis can be tilted forwards, but what we see more often is, Martina going to a posterior, this is what we see more often, especially into the rotation. So I can either use my hand on Martina's sacrum, or I can use my leg and stabilize the pelvis, or I can use both hands on the hip bones. And I'm placing my hands on the hips again, so I have a good placement of my hands. It's not hard, it's not gripping, but it's solid. So when Martina moves into the movement now into, say, a lateral flexion, I can prevent shifting of the hips to one side by giving Martina a sense of anchoring in that side of her hips, so in her right side. And then Martina's moving into the rotational movement, and I can assist the stability of the pelvis, either preventing posterior pelvic tilt or hip flexion. Both sometimes is it's a pattern we see. So other side, let's do that again. So anchoring one side of the pelvis, and then I'm guiding into whatever direction I need to guide the pelvis by sense, and then there's a nice centered, stable sensation in the pelvis. Now we are moving upwards to the rib cage. So Martina, if you can turn to the back, or turn your back to the front. So the rib cage rotation, so the lateral flexion is first. You can go into lateral flexion, beautiful. I can still use one hand on the side of Martina's pelvis to give her a sense of anchoring, and then I place my other hand onto the side of the rib cage. So rather placing it to the back, the aim is thoracic rotation, rather than placing it onto the back and give Martina a sense of moving forwards by pushing her a little bit forwards, I place my hand onto the back, but more to the side of the rib cage, and then she rotates down, and the sense is an upward motion into rotation. So rather than a downwards forward motion, if I have my hand here and do this, this is a very different sensation. Then I place my hand here and I'm giving her a sense of direction. It's upward and forwards rather than downwards and forwards, and I could just very lightly give a sense of direction on the other side. So Martina, if you like to go to the other side. So stabilizing the pelvis with one hand, the other hand is guiding the movement, giving a sense of direction. And this is light touch. I'm not doing much. I just give a sense of direction. And then back to a centered position. So from the rib cage and the thoracic spine, we are moving up to the shoulders. Martina could actually turn forwards. And then arms out to the sides. And once again into a lateral flexion. So there's a sense of broadness in the shoulders throughout the movement. Now, speaking of this top shoulder here, Martina's left, the shoulder blade is stabilized and the shoulder is stabilized. Sometimes what we see is too much elevation. Looks something like this. So either the shoulder can be lowered through awareness and engagement of the muscles, or the arm needs to come more forwards to make it easier for the shoulder to be lowered. What we want to avoid is excessive depression. Can you just depress? Yeah, beautiful. Because as you can see very clearly, it takes some length out of Martina's waistline. So there's a happy medium. It's not excessively depressed, but it's also not lifted. So I can assist that by placing my hand on Martina's shoulder. But before we do that, let's move to the other shoulder. So sometimes it looks exactly right, or it looks a bit like this, especially when there is weight on that, right now, Martina's right hand. So this shoulder needs to come back and down, not excessively, but definitely back and down to give that the length back into that shoulder, and the weight needs to come off this hand. Therefore, these muscles have to work more. So I can place my hands very lightly on Martina's shoulders, and slight touch, but it's purposeful touch. And this is my intention. I'm moving her shoulders slightly apart, and I just follow the movement, keeping the front open and the sides really broad. And then back to a centered position. Here I would have an even lighter touch. I don't want to push down. And then to the other side, so I keep the touch really light. I make it a little bit more definite as Martina is going into the rotational movement. And then back up, I keep it definite. And then when Martina is coming up, I make it very light, because that's plenty. And then you can relax your arms. I hope that gave you a little bit of insight into this variation of the mermaid as a practitioner and also as a teacher.